Yeah, I'm Dr. Dave Hnatow. I'm the medical director, one of the medical directors down here at the Restoration Center. My primary role is a medical director for several units, including the public safety unit, also known as the sobering unit. Well, I kind of initially got involved with the center back around 2003. I was actually kind of drugged down to a local police station subunit where the police department was starting to learn crisis intervention training, CIT training. And they wanted to know what I could do, because I was the director of the University Hospital Emergency Center, what I could do to help them, because they didn't really know where to take the patients to once they identified people out in the public who were in acute mental health crisis. We didn't really have a great system back then. This is back in 2003, and they wanted to know if I could help with helping develop a system where they could take patients to. So I worked with the center over about a course of almost a year and a half to 2 years. And we would kind of meet once a month, and I developed this thing called the Community Medical Director Roundtable. And what that was meeting with medical directors from different organizations. Oftentimes all of us touch these patients one way or another, but I had folks from the state hospital, medical director from the jail, medical directors from the center. And we sat and talked about what we could do to maybe have the police be able to take these folks to one location without bouncing them around town, trying to get that psychiatric care that they needed. So we actually came up with this crisis center model where we would both provide primary care and mental health care at one location. So that was actually, believe it or not, that was a very novel concept back in 2005. We actually started out over at the Brady Green facility, and that's where the police would take their patients, and there would be a family physician available, and the psychiatrist would be there to help evaluate these folks. So instead of being sent all over town, being turned away at various emergency rooms or other psychiatric facilities, these folks were able to be managed at that location. We actually started on Labor Day 2005, which was the same weekend that, unfortunately, Katrina hit New Orleans. And we actually set up a team of folks that went down to the Kelly Air Force Base to provide medications for many folks who got displaced from the New Orleans because of the storm, who needed their psychiatric medications and stuff. So we kind of like got thrown into the fire on the very first weekend that we started this process. The process actually seemed to work. I think it was something that I couldn't really model after anybody else because nobody else had anything such as this. And we kind of moved forward. I think the center was very proactive on developing a lot of this, working with the police department. And I was really just trying to engage the rest of the medical centers and facilities to kind of buy in on this. Subsequently, we kind of expanded over about a course of 3 years. We bought the facilities here over on Frio, and we eventually opened up a sobering unit because the jail was having a lot of problems with inebriates, and it wasn't a safe environment. And we could provide a safe environment for the police where they could just drop them off, and we let them sober up here under supervisions of EMT, and then we'd have LCDC folks interview these folks for people that might be interested in stop drinking or doing substances and enrolling them in our detox program, so which we also have here right on site. And I think that was kind of the key for a lot of this stuff. I called it one-stop shopping, but really, when you come into this facility, no matter which door you go into, whether you're having an acute mental health crisis, or you're having you're intoxicated, or you want to go through detox, we have that all available here. And then eventually we even ended up doing primary care on top of all that, mostly dedicated for these folks. And we have our OATS program, which is our opiate addiction program. It's also located here on site. So I think it was an experiment that no one ever did before, and it seemed to be quite effective as having, like I said, one-stop shopping. I think it's very consumer, patient-centered, and over time we proved that it was also a very safe and effective way to deliver an alternative healthcare model than what the prior situation was, because everything was very siloed prior to that. The center here has been a leader in that. We were really one of the first people to step into that realm where we're going to provide primary care at the same location where people are getting their mental health needs met. And we've expanded it now to all of our clinics. I think it's very critical because people with mental illness oftentimes get shied away at the doctor's office. They can't sit there and wait. The doctor who has 10-minute appointments cannot really address all the needs of our patients, our consumers. Subsequently, we're more versed at dealing with that. We know that it's going to take a little bit longer, these folks, and we have to give them that time. And if we want to be able to get their diabetes under control or their high blood pressure under control, we need to know also that their mental illness is under control. No, I mean, I think the issue with mental health really goes back to the 1960s, and that's just the way physical health was separated away from mental health. And you really cannot separate those two. But the government, the way it does its business, the way they pay and reimburse people, they really separated mental health away from physical health. And that included the insurers. Insurers, not that long ago, gave you so many days a year that you'd be hospitalized, and that's it. The rest of the time, you're on your own. So I think that over the last decade, we've made a lot of strides, including funding, getting increased funding for mental health, access for folks with mental health, trying to provide wraparound services for these folks. It requires a kind of a comprehensive program, but we also need to have an integrated health. I would say without a doubt, when you go and see some of the success stories that we have, it's pretty incredible, where you would not recognize that was a person that was homeless, had a substance problem, was living on the street, and met a guy the other day who all of a sudden has a master's degree in social services and stuff, who's now gainfully employed, lives on his own, substance free, and you realize that his life, that change of life started right here. So I think it's very important to let people know all the fine work that's actually being done down here. I think there's many people in the community that don't have any idea that we even exist. And that I think it's important for us to toot our horn a little bit and let people know that we have these programs available. People who have substance issues, we're treating those. People who have mental illness, treating those folks. We do have lots of different programs here. We work with the jail, folks coming out of the jail, many of which who have both mental illness and/or substance issues. And I think we just need to let folks know that we are here and available to assist them in the different programs we have. Our center really provides a lot of different programs. And when I'm saying the center, I mean the whole entire institution, organization.